Welcome to Pedo Teeth Talk, brought to you by the American Academy of Pediatric Dentistry, a podcast show that delivers cutting-edge ideas for the professionals specializing in pediatric dentistry.
We are here today with Dr. Jacob Lee. Dr. Lee earned his DDS from the University of Toronto. He completed his dental internship at the Hospital for Sick Children in Toronto, earned his diploma in pediatric dentistry at the University of Toronto Faculty of Dentistry, was conferred fellowship by the Royal College of Dentists of Canada. He was an associate professor at Loma. He's had all kinds of academic appointments. He served as chair of pediatric dentistry at Pacific Dugoni School of Dentistry in San Francisco. He's been director of the residency program at USC, dental director for Children's Dental Health Clinic at Miller Children's Hospital in Long Beach. He's done an awful lot in academics and in private practice, as we'll now talk about. He's a graduate of the Academy's Leadership Institute, the AAPD's Leadership Institute. He serves and has served on numerous committees, including the chair of the Graduate Student Research Award. And now he and his son are the co-chairs of the Local Arrangements Committee for our annual meeting coming up in San Diego in a few months as of this recording. He's also served as president of the California Society of Pediatric Dentistry, as a trustee of the Western Society of Pediatric Dentistry, and as the AAPD Western District trustee. He's a fellow of the AAPD and the American College of Dentists. We will post his entire CV online, and I urge you to take a look at all the amazing accomplishments of Dr. Lee. He's now engaged in private practice with his son, who is a pediatric dentist, and with his daughter, a dental hygienist, in San Clemente and Rancho, Mission Viejo, California. He's an accomplished classical violinist. I think I want to get a podcast on violin, and enjoys performing with his children. Thanks for being with us on Pedo Teeth Talk, Dr. Lee.
Pleasure to be with you, Dr. Berg.
So we have kind of a fun, exciting topic today. I just myself learned about this course that we're offering at the annual session in San Diego on the subject of PEARS. And I didn't know what PEARS was. And I've learned that you're an expert on PEARS, but you too only relatively recently knew about it. But so tell us a story about what you first thought of when you heard the term PEARS, P-A-R-S, like the fruit, and how did you encounter it? And then we'll go through this podcast to educate our audience about why they need to be involved with the PEARS course.
Well, thank you, Dr. Berg. Your comment about being an expert, I'm an expert in the sense of a person who actually took the course, and this is more of a testimonial, not as an instructor. But the PEARS course itself had a bit of, in my life, had a inauspicious and kind of funny beginning. 2-3 years ago, when Dr. Jade Miller was a chair of the safety committee, one day I was a board liaison to the committee, and he leaned over and asked me, do you know anything about PEARS? And rewind a few minutes before that, and we were talking about how Dr. Jade Miller has a vineyard, and I talked about my having citrus trees in my backyard, growing oranges, lemons, and kumquats, what have you. So when he asked me, what do you know about PEARS? Immediately I put one and two together and thought, oh, he wants to now expand from his vineyard to having orchard of pears. So I kind of responded saying, I don't know anything about growing pears. And he kind of looked at me funny. He said, no, I'm talking about the American Heart Association of Pediatric Emergency Assessment, Recognition, and Stabilization PEARS course. And I went, oh, well, you didn't start off with AHA. You just talked about PEARS. So that was the beginning. So what
is PEARS then? Tell us, what is PEARS, not the fruit, but the course? What is it?
Course itself is between the, in a sense, BLS that we all take, and then the PALS. So it's kind of a medium serving our staff as well as our providers, working together as a team to provide support in the initial onset of distress for our pediatric patients. So I did the research, and I wasn't happy with the research by itself. So I actually brought down the expert provider of PEARS to my office and had my entire staff take the course. And it was quite edifying. And on top of that, when I got the feedback from my staff, they actually said they felt competent and confident.
Mm,
And as we know, competency without competency is almost meaningless
mm,
because if you're not confident in the crucial moments,
right.
they're going to be frozen and they're not going to help you. So I don't need staff watching me work. I need them to work with me.
Right. So they work as a team at that moment when you need them to work as a team.
Yes, yes. I need them to help me and just be frozen and sit on their hands, so to speak. And the funny thing after that was that they had that look of that confidence, and I know that look of confidence because whenever they do something great, look confident and they look at me like it's time for a raise. So
Well, yeah.
I
So
gotta
so
treat people
pairs
that way.
pairs obviously you and I chatted about this and I've learned a lot and I'm going to learn more
Yes,
today, but it obviously offers something that hits the sweet spot that we need for our team, maybe in a better way than PALS. And although we're not going to talk about the regulatory stuff and today, PALS may be required to do sedation in some states, even for the team. But why is pairs maybe from an appropriateness perspective a really good thing for our pediatric dentists and their teams to consider taking this course?
so when we compare BLS, pairs, and PALS, as we all know that BLS objective is to recognize cardiac arrest and provide CPR for adult, child, and infant, providing chest compressions and ventilations, as well as early use of AED, and also providing emergency care to a choking victim. So that's the basic, and that's the foundation of all rescue, providing rescue. And then PAIRS builds on BLS by utilizing all the skills of BLS. At the same time, you learn to assess, recognize, and I would say perform early management of respiratory distress in a patient. And you also learn the techniques of support and assist with the use of such as oropharyngeal airway, OPA. Then PALS builds on top of those two, BLS and PAIRS, by utilizing advanced pharmacology and also using the various forms of vascular access, including intraosseous. And as you know, we spend tremendous amount of time reading and interpreting electrocardiograms and learning how to recognize and handle obstructive and cardiogenic shock, and also use of advanced airway like endotracheal tube. But PALS is, to me, is more like geared towards critical care, ICUs, and emergency medicine compared to pairs, which is more of on-site. And one distinguishing feature about in training of pairs and PALS is that pairs is in-person course alone, whereas PALS is there are two-part to it. We take online course, part one, didactic portion, and the practical portion is the part two. So these are the kind of three, but all three have the basis of having a very effective communication so the team can perform in a highly functional manner.
So would you say that the airway management part is really the part that's more appropriate in that emergent situation for the entire team to learn and train on together, and that's the distinction of pairs? It doesn't do things that are unreasonable maybe that we would do, like electrocardiogram analysis, intubation. Just as a way of kind of structuring my question a little better, I remember when I was involved a lot with resident training, pediatric dentistry residents, they do the month of anesthesia, and everybody wants to intubate. Everybody wants to start IVs. Those are important things. But the most important thing, I think, always is how to manage the airway, how to stabilize the mandible, how to manage an airway first and foremost. Is that something that PAIRS delivers on for the team?
I think so. And my truly personal opinion is my brother-in-law, who's a medical anesthesiologist, once asked me, how many cardiac arrests have you seen, let alone treated? And how many trachs have you performed? So when you think of all this,
Mhm.
and when I look at some of the morbidity and mortality and sedation, it seems like a lot of the providers try to attempt advanced airways and
Mm.
so on that they're not really familiar with.
Yeah.
And I think that's critical portion. And at the very initial moment, you really want to have something that's really not only easy, but really efficient and effective that you can get on. Because first few minutes are the most critical moments, as we know. And then you call the EMS, and then you have them take care of it thereafter. I think overloading with information, and that would create hesitancy and perhaps maybe inefficiency in managing the early crisis.
So I know the APD is involved in this PAIRS course. Obviously, it's being offered at the annual session. this year in May. And it'll be an ongoing thing. I think it's going to evolve further, it sounds like, into something more significant for us. So how is the APD involved? And maybe who is going to be giving this course? Is that the same person that came to your office?
Yes, his name is Mr. Jeff Labs, and he's been in practice for many, many years. And he actually is the provider of PALS as well at the AAPD meeting. But also he's been providing PALS for California Society and Western Society, as well as a number of dental anesthesiologists. And if actually my own dental anesthesiologist takes ACLS and PALS from him. So he's well acquainted and well versed with dental setting. And that's what makes him a much more suitable trainer for this PEARS program.
And if I were to ask him today, one who teaches both all those things you said, PALS, PEARS, ACLS, what would he say about the distinction of PEARS for pediatric dentists and their staff?
I think for the team to work together in sync and in synergy, he'll probably say PEARS is the best optimal program for the crisis that we would encounter, and also prevention as well, not just management.
Well, you had me at hello when we talked the other day. I feel like I need to learn. I need to go to this PEARS, whether I can go at that point or I'm going to get it done. So from a timeline standpoint, how has this evolved for you personally? When did you first get awareness about it? You said you brought this expert to train your team. How did that all go over time?
So when I was kind of commissioned to research into this by Jade Miller and the safety committee, I looked into it, researched it, and it went through a number of scrutiny. For example, our subcommittee on sedation and anesthesia, chaired by Travis Nelson, reviewed it, and the committee approved it. And the Council on Continuing Education, headed by David Avenatti, also reviewed it and endorsed it. And of course, the Board of Trustees reviewed it and they approved it. And currently, the chair of the safety committee, Joe Castellano, and the entire safety committee have approved it. And by the way, for this upcoming course, it is my understanding the two chairs of the safety committee, Jade Miller and Joe Castellano, will be at the course to lead by example.
That's exciting. Yeah. And I think, you and I have talked a lot about safety in general, the safety committee's work, which is really a recent phenomenon, relatively speaking. But I think our specialty is taking a lead in this, and we're talking about all kinds of advancements related to safety. We will now pause for a word from our sponsor.
Hugh Freedy is the global leader in dental instrument manufacturing and infection prevention solutions that keep you performing at your best. For more information on Hugh Freedy products, visit hughfreedy.com/AAPD crowns. That's hugh-freedy.com/AAPD crowns. And enter the promo code 2682 if placing an order for pedo crowns.
We are back with Dr. Jacob Lee. We're having an amazing conversation about PEARS and why we're all going to want to be interested in not the fruit pears, or maybe we can have the fruit, but we really need to know about this course, which is being offered at the annual session. And I think beyond, we're all going to get engaged in this. So Jacob, you and I were chatting about this, about the whole teamwork part. And, I can't help, and we shared this story together that aviation has a lot of examples it gives to us when it comes to safety. And, I always like to cite it. I've trained with pilots and safety experts from airlines. And, when those guys go to the simulator twice a year to update in the simulator, they're not learning how to fly the plane. They already know how to fly the plane, like we know how to practice dentistry. What they're learning to do is to be ready if an emergency happens that they hope will never happen. And that's really what PEARS is about, is it not? And we'll come back to this with another question.
Yes, because as we know, while we're doing oral sedation, there are umpteens of factors we are considering as operator while we're performing dentistry. And it's sharing of responsibility and having extra eyes and ears, so to monitor to make sure that the patient is safe. And for example, during this PEARS course, the attendees will learn video-based exams, and they really learn to differentiate between different breathing patterns, for example, stridor, wheezing, and crowing. And they learn to know what different pulses, blood pressure. So it's much more advanced than just basic BLS, but we don't go into all the full pharmacological aspects that can overwhelm our team at the time of extreme need. And I think that's the important factor.
Yeah, and I think, as we discussed, the communication of the team, it's really, the training is about training on communication. And you mentioned earlier, we all shouldn't be sitting on our hands. And I think you referred to scenarios where if a pediatric dentist has an emergency and the anesthesiologist is there, historically, we just kind of step back and let that person take over, when in actuality, we need to work as a team with them, just like our team needs to work with us during a sedation. In aviation, they call this crew resource management, CRM. And if you look at the history of aviation accidents, they dramatically declined once we started allowing and encouraging the team to work as a team and not have a hierarchy in the cockpit, so that everybody feels comfortable speaking up. We've started to do this with timeouts and, things like that, and make sure I'm taking out the right tooth and stuff like that. But what's your comment on, the communication part of this? Because I think, to me, it feels like that's one of the most important parts.
And I think, of course, communication is important, but practicing how to communicate is also a very important factor, so that it becomes part of you and free-flowing during the moment of crisis. So, for example, at the end of this course, Mr. Jeff Labs has provided a small gift to all pediatric dentists who attend, a small pediatric mannequin. It's tiny, so you can take it home and to practice, because his mantra is that perfect practice makes perfect performance.
Mm-hmm.
And, as we know, athletes and musicians constantly practice on things so that by the time the performance comes, it becomes a routine. So I think, constant practice and communication, we all know how important that is in our daily practice, but especially in the moment of stress and distress, I think we have to learn how to communicate effectively and efficiently. And that's the crux of our whole approach.
Well, I think you've sold us on PEARS. I want to just reflect on some of the things we already talked about to kind of summarize as we get to the last part of our talk today together. So PALS versus PEARS, if you were just to make some bullet point comparisons for us between the two.
Well, PEARS is more of as a team, you learn to assess, recognize, and perform early management without going too much into pharmacological and advanced vascular arenas. And there's no aspect of interpreting electrocardiograms in a sense that you are just hands-on and taking care of initial aspect of that. So that is probably the most differentiating aspect of early management.
Okay, and then I said I wasn't going to talk about it, but now I feel like I need just to bring it up again, the ACLS part, or the PALS part in our case, and that, without going through a chart of all the states, regulatory bodies take a little longer to respond to marketplace demands and needs and what's standard of care in the profession. So for somebody who is required to take PALS, can you tell us why this incrementally would be of value to them if they already are PALS certified?
I think providers should take, pediatric dentists should be PALS certified, but I think the team, it's really efficient for the team to take the PEARS course because it's much more attuned to applicable to their setting compared to PALS, where they really don't need to learn so much all about advanced pharmacology and so forth. So I think in terms of our dental boards and so on, they are much more familiar with PALS as we were, but I think it's time for us to advocate that PEARS is much more clinically applicable. For example, our local hospital, Children's Hospital, Orange County Children's Hospital, all the staff outpatient clinic are trained in PEARS, not PALS, because they found that PEARS is much more appropriate because for the staff to handle crisis at the moment with patients in need.
So is PEARS, is it used also in medical management and in medical scenarios, not just dental?
Yes. Well, we all adapt and extrapolate from medical settings. So like BLS, PEARS, and PALS, we try to adopt. And I know American Heart Association allows a small allowance to tweak the program. So Jeff Labs will be trying to tweak the little program to be much more dentally applicable as well.
And if we want to learn more about this online, should we go to the American Heart Association website? Would that be the place to look?
Yes, that'd be a good beginning to do that, and you can discern and find more information in greater depth.
Well, you've sold us on the need to do this, and I'd like to, we all want to keep learning from you, and we're grateful that you had this experience and that you had your team train with this. Nothing better than personal experience. Have you heard from others who've done this? Have you heard from colleagues who've had their team trained, and what has been their response, if so?
Yes. For example, Bobby Thickersey, I think he wrote in recently on the eBlast how he thought this was so appropriate for the staff. And he's one of our instructors in the APD for sedation.
Right.
So that's a huge endorsement coming from him. But I think it's catching on. And this is where the importance is. I think we need to be examining this program carefully and then practice it and then learn from it.
Well, this is one of my favorite things to do is talk to people like you, Jacob, who've been there, done that, and can tell us what that means. And you've sold me, and I think you've sold our audience today. So any final words on PEARS? And if somebody listens to this a year from now, we're in March 2022. So if I listen to this a year from now, is anything going to change, or is it the same valuable information?
Well, let me give you one experience. Many years ago, and I'm dating myself, when the pulse oximeter came on board, and I was giving a presentation on oral sedation, and I wouldn't say a heckler, but one person blurted out, that machine costs over $3,000. And but Back to the Future, now present day, we can't even think of doing oral sedation without a pulse oximeter. And what I'm getting at is, I hope our members remain at the forefront of sedation, safety in sedation. And if real estate is location, I hope sedation becomes safety. So I hope our members will take PEARS with their staff, not the fruit, the course. Mm-hmm. And I can guarantee they will not regret it.
What a great message. Thank you so much for your time and for being with us today on Pedo Teeth Talk, Dr. Lee.
Thank you. It's been a pleasure. Thank you very much for having me.
Do you need additional CE hours but don't have time to travel to courses? Did you attend Annual Session and want to listen to the audio recordings? Check out AAPD's new Education Passport. The redesigned and improved Education Passport is AAPD's online learning center, where you can earn CE and listen to audio recordings from all of our continuing education courses and more. Visit educationpassport.aapd.org for more information. For 10% off any product, use discount code TEETHTALK in the Education Passport store.
Pedo Teeth Talk is brought to you by the American Academy of Pediatric Dentistry, the show that delivers cutting-edge ideas for the professional specializing in pediatric dentistry. If you have any questions or comments, please email info@aapd.org. We welcome your ideas for future shows and guests. For more information on the American Academy of Pediatric Dentistry, visit aapd.org.